Good morning, good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, Dominica, this is the Daily Medical Tidbit. Today, I want to touch on a topic. I don't know how many of you have heard of it. It's called spider angioma. Okay, it can also be called spider telangiectasia or spider nivis. All right, and what it is. It is a type of abnormal blood vessel. It looks like a small red spot with tiny vessels spreading outwards, just as I have the image on the screen, similar to the legs of a spider. Right? It can be very subtle, very small, but the central spot, which is the artery, which is the blood vessel, is red, cherry red. All right, and the legs of the spider is what's called capillaries, the small vessels that lead outwards. Okay, and when you press on the central area of the spider angioma, the whole structure fades because you're decreasing the blood flow. When you release it, right, it again fills up. So it can appear anywhere on the body, but then more common in the upper chest, right, upper chest and the upper abdomen, sorry, your face, arms, anywhere. But what causes spider angiomas? As I said, it's the dilation of small blood vessels in your skin, right? And it's linked to actually increase estrogen levels, all right? Or sometimes just changes in the blood vessels themselves. A lot of it can be normal, physiologically normal. Other causes can be during pregnancy because you have increased estrogen, all right? It's seen in childhood, but those tend to resolve naturally. And then there are things like chronic liver disease, which is what I want to emphasize, especially when you have cirrhosis. If you start seeing a lot of these spider angiomas and you're a heavy drinker, you know you're in trouble. There might be signs that you have underlying cirrhosis, right? And obviously alcohol-related liver damage causing that. All right. Those on oral contraceptive, especially estrogen therapy, can have this. All right. So what I want to emphasize today is spider angioma is an important clinical marker of liver dysfunction, especially as I stated before in cirrhosis due to alcoholism. All right. So the liver in that situation has difficulty metabolizing your estrogen, right? So that leads to higher circulating estrogen in patients with liver disease and cirrhosis, right? And that promotes that abnormal vessel formation in the skin called spider angioma, spider nivis, right? So patients with cirrhosis often have a lot of spider angiomas, all right, and quite a bit. So you have to look for it as a clinician. You have to look for it, and you have to get a thorough history from the patients. And a couple of things you have to add to that, if you're focusing on chronic liver disease, is what called palmar erythema, red palms. All right, gynecomastia, which is enlarging of the breast tissue, especially in men, and ascites, which is fluid in your abdomen, and obviously jaundice, yellowing of the skin, yellowing of the sclera. Okay, so again, excessive alcohol use, all right, damages your liver, and that leads to alcoholic hepatitis and alcohol cirrhosis. As your cirrhosis progress, you're going to have these spider angiomas. So next time you stand in the mirror, you look at yourself, look for these spider angiomas. I have the image on the screen. All right. So again, if you have several spider angiomas in somebody with a history of alcohol abuse, that strongly suggests you have advanced liver disease. All right. So I just wanted to do some education in that regard so that folks can fully understand these things, right? And again, the treatment really is improving your liver function, right? Stop consuming alcohol and all these other, things. You can go to surgery and have them remove them, but if the underlying cause is not treated, they will continue to disappear. So it doesn't make sense, all right? So I just want you guys to understand this. They can appear in healthy individuals, but when they start popping everywhere on your body, you're suggesting that you have underlying liver disease. Just some education for today. Have a great day. Peace.